8-year-old lady has difficulty in using her hands. We're asking the students to examine her hands and they should assess the hand function. The findings are she has got a very tight skin here. She got some calcinosis. You can see very closely, if you look, she's got some telangiectasia. And can you roll? Yeah, there's a very nice spot of calcinosis here. And she also may have some telangiectasia here, and she has lost the pulp of the finger here. The hand function can be done by using the routine rheumatological examination, and also looking for things like trying to open one of the screw tops bottles. Can you open that for us, please? They're difficult. That's okay. That's okay. Again, when you look at her face, the skin is very tight. Again, she has some telangiectasia here. Are you open the mouth? Okay. Are you able to put 3 fingers in your mouth? How many can you put? Maybe 2. Okay, thank you. And she also has some tightening of the skin in the chest here. We won't be asking the students to take a history, but if they had to take a history, they should be asking for what happens to her hands when she goes out in the cold, looking for Raynaud's syndrome, difficulty in swallowing, and also asking history regarding pulmonary fibrosis. That will be a very excellent assessment if they do all those things.
Hi Judy.
Hello.
My name is Kylie.
Hi.
I'm aware you have some difficulty using your hands. Is it okay if I have a look at your hands today?
Certainly, yes.
Thank you. And could I have a look at your elbows as well?
Mm-hmm.
Thank you. And put your hands this way for me.
I can't get them all the way over.
That's okay. Thank you. And now I just want to have a feel of your wrists and your hand joints. Are you in any pain at the moment?
No, not at all.
Just flip your hands over.
Mm-hmm.
Can I get you to close your fingers for me?
That's as far as I can go.
Thank you. And this side.
Not very far.
Now I'm just going to move your hands and joints.
Mm-hmm.
Just try to relax for me.
Mm-hmm.
Thank you. And could you put your hands out in front of you like that and try to bend your wrists down as far as you can
That's as far as I can go.
and up,
Oh,
trying to keep your hands
straight.
Yeah. Thank you. And could you move it side to side your hands. Okay. Like that.
Like that. Not much.
Okay, thank you. And could I get you to squeeze my finger
Mm-hmm.
as hard as you can? And put your hands in a fist if you can for me, please.
That's about as much as I can do.
And stretch your fingers out as much as you can, as straight as you can. And together. Thank you. And now I'll just get you to point your thumbs towards the ceiling like that, if you can. And don't let me push them down.
Alright.
And now push down towards my fingers. And push out if you can with your thumb. Thank you. And can you do this for me? Make a pincer grip.
Sort of. Yeah.
And try and hold the grip.
Okay.
Don't let me pull it through. And with your pinky as well. Your thumb and pinky.
No, can't do that one.
Okay. Are you able to flex your fingers at all? And this hand?
This hand's not so
Oh.
good.
Thank you. And could I get you to do this with your hand if you can?
No.
Or the other way? Okay. Thank you. And if I can, could I please get you to open this jar for me?
Mm-hmm. Sometimes I can, but
That's
it's a bit tight.
okay. Thank you.
Is there anything else you would like to do?
I'd like to have a look at the face.
Okay, and then, yeah.
Could you open your mouth for me as wide as you can? Thank you. Just feeling for any thickening of the skin on the chest.
Okay, that's good. Would you
Thank
like
you.
to tell us what you think is wrong with this lady and your assessment of her hand function, please?
I think the lady has scleroderma,
Mm-hmm.
and the hands are very stiff with thickened skin and loss of movement in nearly all the joints, especially the DIP and PIP joints. Wrist movement is also reduced. From the inspection, I can see the skin is very thickened, and there are some areas of ulceration and calcinosis
Yes.
over some of the joints. She has some weakness as well, and she's got her facial skin is also affected,
Okay.
and her neck skin.
So what's the diagnosis then? Scleroderma or?
Perhaps systemic sclerosis.
So if you have time, would you ask her any more history? If you think she has scleroderma?
I would ask about Crest syndrome. So whether she has Raynaud's in her hands, esophageal problems.
Okay, that's good. Thank you.
So this part of the video is going to be demonstrating the evaluation of your deep tendon reflexes. You want to make sure that when you're checking reflexes that the patient is relaxed, but that the tendon is on some kind of stretch, otherwise you won't get a reflex from it. So we want to make sure that we test them in both upper and lower extremities, and we test them bilaterally. So we're going to start with the upper extremity and the biceps reflex. So this is a reflex on the biceps tendon. And what we want to do for this one is, again, the patient's arm is to be sort of relaxed in the patient's lap. And I'm going to put pressure on the biceps tendon in order to stretch it a little bit. And then I'm going to strike the tendon with the reflex hammer on my own finger. I should be able to feel the reflex in my hand, even if I can't see it in the muscle contracting. Alrighty. Again, for that one, you could see the arm jumping, but I could also feel the reflex myself. When you're doing the reflex, make sure that it's a quick, rapid, it's not a flunk down and hold it, it's a quick, rapid tap. So we'll do that again. And again, we want to make sure that we do that bilaterally. Alright. So we also want to be able to do the triceps reflex. For the triceps reflex, again, we need the arm to be relaxed, but the tendon to also be under some stretch. So we need the arm to be bent. So generally we will hold the patient's arm out to the side and have their arm bent. And let me hold as much of the weight as I can. Okay. And again, strike the triceps tendon with the reflex hammer directly. And again, you notice a slight swinging of the arm out laterally when that's struck. And again, make sure you do the same thing on both sides. And so just relax the weight into my hand. And you notice the slight jerk of the arm outward. So finally, we're going to do the patellar reflex and the Achilles reflex in the lower extremity. So for this one here, make sure you find the patellar tendon and just relax your leg as best as you can. And the same thing on the other side. So this patient has good brisk reflexes. They're not hyperreflexic, but they're easy to see. Some individuals' reflexes are much more subtle than that and a little harder to see. Finally, we want to do the Achilles reflex. If I let the leg dangle like this, the Achilles tendon is relaxed and not under any stretch. So you want to push up on the foot so that the tendon is stretched. And it's generally easier to strike it with the back of the hammer, but you can strike it with the foot. So again, just relax as best as you can. And then the same thing on the other side. Try that one more time. All right. So the next reflex we want to do is the plantar response reflex, which is also referred to as the Babinski. So what you're going to have the patient do is if you could move back on the table a little bit for me, and I'm going to pull out the footrest. And so you want to do this is you're going to run an object relatively firmly across the dorsal aspect, the plantar aspect of the foot. And you want to make sure you use something clean and new each time so that you're not, again, transferring things back and forth between patients. Because this is a relatively firm pressure. So we generally use a new tongue blade for that. What you're going to do is on the sole of the foot, you're going to run the tongue blade up the side and towards the midline. You want to do it relatively quickly and with decent pressure. This isn't a tickling motion. You want it to be relatively firm. And you want to watch for the direction that the toes curl. All right. So I'm just going to run this tongue blade across the bottom of your foot. Now you notice it was a subtle motion, but his toes curled towards the plantar surface of the foot. So toes down going is the normal response. If when I did that motion his toes pointed upwards, that would be upward going toes or an abnormal response to the Babinski.